Hi everybody, Dr. Rob Lindsay again with Diabetes Treatment Success number 11, brain function. Now brain function is extremely important in treating the thyroid, diabetes, or any other condition. The brain controls every bodily function. Your pituitary drives your thyroid gland and it releases TSH. The part of your brain called the hypothalamus drives the pituitary. Now our brain again needs two things to survive, fuel and activation. Fuel is glucose and oxygen, which is why we use exercise with oxygen therapy, EWOT, in our office. We have to address the glucose with what you eat. Now let's talk about the importance of oxygen. As you age, the ability to utilize oxygen decreases by 1% per year each year after the age of 25. Now if you're 50 years old, you've lost 25% of your ability to utilize oxygen in your body. This is called oxidative phosphorylation, which is a big fancy $3 term meaning you're not using oxygen as well as you did when you were younger. Again, this is why we utilize exercise with oxygen therapy in our office. Secondly, the neurotransmitter serotonin plays a major role in thyroid function and in other functions. There's a place in your body called the hypothalamus, and there's something called the periventricular nucleus. I know these are big fancy words, okay? But it's critical that you know this is if you're suffering from diabetes, thyroid symptoms, or whatever. Serotonin acts on the hypothalamic periventricular nucleus in the central nervous system, and what it will do is make you have low thyroxine stimulating hormone or low TSH. Now again, taking thyroid hormones for these problems is not going to do anything for you. It will most likely make your symptoms worse. Don't get me wrong, I'm not telling you to stop taking your medication, okay? That's called practicing medicine without a license. But you need to be aware of what's happening in your body. Now I'm saying be aware of what's happening because once you start asking medical doctors why am I taking these medications, they're going to look at you like you're crazy, like you have some psychosomatic illness, which means to them, it's all in your head. And the only thing you need is an antidepressant, right? So the biggest influence on serotonin is blood sugar. That's why we address glucose in our other treatment success secret. So if you're hypoglycemic, insulin resistant, or diabetic, it's vitally important that you maintain your blood sugar levels within an optimal range. And this is why it's important to eat healthy. Don't skip meals. Quit eating junk food. Every time you eat junk food, you're literally eating away at your thyroid and you're making your problem worse. By consuming a poor junk food-filled diet, you will increase your thyroid symptoms, feeling tired, feeling sluggish, you won't be able to lose weight, your hands and feet are cold, you have insomnia, you'll gain weight easily, you'll have difficult, infrequent bowel movements, depression, lack of motivation, morning headaches that wear off later on in the day, the outer third of your eyebrows you may be losing, okay? Your skin, your scalp are dry, you have mental sluggishness, you're nervous, you're emotional, you have night sweats. You have all of these symptoms, and yet your labs are normal in the eyes of your medical doctor. Remember, those labs need to be within the optimal or functional range. We'll look forward to seeing you on the next Success Secret.